very much, Madam Chair, and I'd like to thank Dr. Muntz for joining us today to discuss the proposed CMS rule. This rule has far-reaching implications, particularly in our home state of New York, where Medicaid is funded through property taxes and many other taxes. New York State firmly holds its place near the very top of the list that has the highest property values, and property taxes are a tremendous burden throughout my district and throughout the entire state. The consequences of this entire rule are clear: to increase federal spending, and inevitable higher costs will burden hardworking American taxpayers, especially those in New York's 23rd Congressional District. And while we could engage in debates about costs and figures, it is essential to take a closer look at the actual development of this rules and others like this, just as my colleagues have just discussed. Far too often we witness unelected officials within this administration, especially in this particular Biden administration, pushing their own agenda without giving consideration to due process or the impact on the American taxpayer. It is crucial that we hold the government accountable and ensure that policies are thoroughly examined, transparent, and genuinely beneficial to all of our constituents. Dr. Muntz, why did CMS decide to develop this rule, and what was the rationale to extend benefits to DACA recipients when the Obama administration did not do this in 2012?
Thank you for that question.
Hello.
The CMS is committed to expanding quality, affordable health insurance coverage throughout all of our programs consistent with the law. To that end, we proposed this rule, which would align with the current definition of the Department of Homeland Security's longstanding definition of lawful presence, would align HHS's definition of lawfully present with that of the Department of Homeland Security, ensuring that DACA recipients are treated the same as any other recipient of deferred action under the law. The reason why we pursued this proposed change, in addition to those two things I mentioned, is, with time and experience under the DACA program, we have learned that while the majority of DACA recipients receive health insurance coverage through their employer, still a third of DACA recipients remain uninsured. And we know that uninsurance can lead to certainly detrimental impacts to both individuals, but also our economy.
So just to be clear, no congressional authority has been granted to CMS to make this rule change, and the Biden administration has not issued an executive order dictating this rule change.
Under this proposed rule, HHS is pursuing this proposed rule under our authorities under the Affordable Care Act and CHIPRA 2009 to define lawfully present and lawfully residing.
So in developing this rule, did CMS seek feedback from Customs and Border Protection or U.S. Immigration and Customs Enforcement?
Just like any development of a proposed rule, that rule is looked at by our HHS, OMB, the White House, and any other affected agencies.
Yes or no? Did you talk to those two specific agencies?
The Department of Homeland Security did review the rule going through clearance.
Okay, and what was their feedback?
I would need to get back to you on the specifics.
Okay. With my remaining time, I want to shift and speak about the impacts of this rule and what it would have on the healthcare systems, especially rural hospitals that are already overwhelmed. In the Southwest, we've seen immense stress and overflow at healthcare facilities. Did CMS consider the impacts that this rule would have on these sorts of healthcare facilities?
In the proposed rules, regulatory impact analysis, we do note that one benefit of this proposed rule would be lower uncompensated care costs borne by the healthcare system. They're ultimately borne by local, state, and federal government.
And all the taxpayers. Dr. Muntz, New York State pays some of the highest taxes in the country for Medicaid. We spend more than California and Texas combined on the program. How would you justify to my constituents in Western New York, which consists of some of the poorest counties in New York State, that their taxes could go up to pay for illegal immigrants' health insurance when they're struggling to pay for their own?
what this proposed rule does is propose to modify the definition, HHS's definition of lawful presence to align with that longstanding definition for the Department of Homeland Security. Under the Affordable Care Act, individuals who are lawfully present are eligible for benefits.
I yield back, Madam Chair.
Thank you. The chair now recognizes Ranking Member Porter.